Hi, this is Dr.Rashmi Shetty. I am a practicing endodontist and aesthetic dentist at Chisel Dental Clinic, Koramangala, Bengaluru. Can cosmetic crowns or veneers be maintained lifetime? Do they necessarily have to be changed? These are simple questions we wonder even when we want to go in for something that is irreversible. Coming to maintenance and all, normally none of these work need to be repeated. No metal-free work nowadays needs to be necessarily repeated again, and it requires basic minimal care to see that it lasts permanently. That includes your regular brushing and even flossing or any interdental aids. Water flosser is only given post your recall visit after 6 months, and that only for those few patients who need that extra care. But to go in for crowns or veneers, it is best left to an experienced aesthetic dentist to decide which is better and which is long lasting for your bite in particular. If you have done any pre-aligning or orthodontic treatment, then yes, veneers will be foremost at the dentist's mind as well as yours. But if not, and the dentist is suggestive of cosmetic crowns or jacket crowns as a more long-lasting options, there is no harm in going for it. Immediately post getting your veneers or cosmetic crowns, once you go back, yes, there will be a settling down period where you will be advised not to bite into it, not to chew on it directly for those 10 days, and you might feel a little post-operative sensitivity until your gums settle down. In that time, regular brushing can be carried out, but if your gums are still sore, try and use a gauze piece wrapped around your finger and the same paste so that you have a little touch sensation and tactile sensation and you are aware that you are not hurting your gums. But yes, post the 2-week checkup, you can slowly ease into biting regular food, and I am sure after a few months, ideally 3 months, most of us forget that we have got something done and get back to our normal life. And these materials that are used nowadays, whether they are your zirconium or your e-max or pure ceramic materials, these are completely aesthetic. They are acid resistant as well as stain resistant. So they look much newer than even your natural teeth for a long time to come. Though your crowns require the least amount of maintenance among all the dental work that is usually done, just as any car that you use requires your maintenance and regular annual visits to your mechanic, the same way any prosthesis that we are using, especially for eating and chewing 2-3 times in a day, requires a minimal dental visit at least once in 6 months, not necessarily for treatment, but just to see that everything is going on fine, and to do a basic cleaning procedure either at 6 months or 12 months as your dentist decides at that point in time.